Fehlk, Femto Excimer hybrid Lamellar Keratoplasty. This technique was developed by blending or mixing techniques to achieve one that is reproducible with little difficulty and with optimal visual outcomes. The technique begins with a lamellar cut with femtosecond laser with an external diameter of 8.5 or 8.75 millimeters, but without making the cut in the middle 3 millimeters corresponding to the visual axis. This cut with the femtosecond will give us sufficient depth for the lamellar technique, which is 100 microns from the endothelium to the surface. We then lift from the cut edge of the disc and manually dissect in the area that was not cut by the femtosecond laser, the 3 millimeter central visual axis area. With this, we seek to create a much smoother and more regular interface, enabling a correct post-operative visual acuity for the patient. We can already see the difference between one zone and the other that is clearly more regular, which is the main aim of this modification in the technique that we usually performed with the femtosecond laser. Then we place an 8.5 millimeter mask to protect the edges of the host tissue and perform an excimer laser photoablation to finish smoothing the interface and get an even finer remaining tissue, which will give us a resulting better final visual acuity. The program we use is PTK at 9 millimeters. We can see at the end of the photoablation how the visual axis has been perfectly regularized, and to some extent we've also improved the periphery. To complete the surgery, after removing the endothelium of the donor tissue, we perform the suture in the recipient eye with a technique usually used in lamellar grafts, with nylon 9.0 combined with 10, with separate stitches, or separate stitches combined with a continuous suture. With this hybrid technique, we aim to make it possible for any corneal surgeon to reproduce the technique that we believe is currently best suited to solve corneal ectasias, with a good final visual acuity and decreasing the risks and the rate of complications.